the way of it. Sad earth over, the heart that breaks is the heart of the ruler, and the other learns to forget. For what is the use of endless sorrow? Though the sun goes down, it will rise tomorrow. And life is not over yet.
Hear ye, citizens of APEIROS, the Queen has arrived.
One would say it was a vast nation, perhaps an alternate universe with its bounty that would have been blessed by Persephone herself. Their ruler was young and beautiful as she was wise. The queen was beloved by her people. It stayed this way for a long time. Two decades have gone by, and APEIROS was still unsurpassed. Outside its walls, the world seemed to be at its usual place. But little by little, changes had begun to take place. Queen Lopez has two rank captains, Jedediah, the first in command, her right hand, and Odysseus, the second in command. The queen, who had always loved to bask in the morning sun, was rarely to be seen. She had moments where her affect easily changes from calm to irritable. And the worst part of it, her behavior has begun to affect her reign. There were changes to her physical state as well. It affected her kingdom. enough, APEIROS was trapped in darkness. Awareness struck the citizens of APEIROS. They sensed that something was not right. On the other side of the kingdom, an uprising was being planned. It was headed by Odysseus. He was more perceptive than others. And seeing that the queen is not in a normal state, he took advantage of it.
Things are going well as expected.
What are their plans, my lord?
Within 240 hours of preparing for the grand case presentation, the citizens of APEIROS will be able to assess the client comprehensively using cephalocaudal approach and Gordon's functional health pattern, identify health threats, health deficits, and foreseeable crises, determine nursing problems with respect to client's physical, psychological, spiritual, and emotional dimensions. Discuss a client-centered pathophysiology of systemic lupus erythematosus comprehensively. Correlate significant laboratory results to the manifestations of the client appropriately. Prioritize identified nursing problems correctly. Correlate significant data and develop an appropriate and attainable plan of care and home care plan in collaboration with the client and significant others. Discuss the mechanism of action, indication, and nursing consideration of drugs prescribed to the client. Evaluate the effectiveness of the nursing interventions rendered during home care. Skills. Record significant data gathered pertaining to client's condition accurately. Provide health education relevant to the client's disease condition and management according to the level of understanding of the client and significant others. Apply principles of therapeutic communication at all times. Collaborate with the health team members in the continuity of care. Make use of available resources like online publications, books, journals, and client's records. Formulating a case study manuscript. Present a detailed and well-organized visual aids. Attitude. Establish rapport with the client and significant others. Provide health education relevant to the client's disease condition and management according to the level of understanding of the client and significant others. Observe honesty in gathering, recording, and presenting client's data. Maintain confidentiality in studying client's case. Accept critique from panelists during the case presentation positively and constructively. Live out the Augustinian values, especially the three core values, caritas, unitas, and veritas.
Ignorance! That will never succeed!
Our emissaries are coming.
Delve into the past. Tell me the events that has happened to her.
Admitted last August 8, 2010, was Queen Lupus, our 20-year-old queen from the kingdom of APEIROS. She was raised according to their customs and traditions. She was able to finish up to her 3rd year in high school, during which she was pregnant. She then became a barangay health worker in her area, as well as managed the home she shared with her live-in partner, Kim JJ. After the birth of her first child, she started taking birth control pills. At the age of 19, she had her 2nd child. A chief complaint of on and off fever prompted the queen to seek consult. She was allergic to seafood, specifically to shrimp. After further examination, Queen Lupus was diagnosed with community-acquired pneumonia, moderately risk, systemic lupus lupus erythematosus with lupus nephritis, anemia secondary.
According to my scout in 2007, the Queen had been using contraceptive pills for 1 year after giving birth to the first child. In 2008, after giving birth to her second child, the Queen is still using the same contraceptive pills. In 2010, 2 months prior to admission to an out-of-town hospital, the Queen experienced joint pain and swelling of the face. 5 days prior to admission at the same hospital, the Queen has an additional productive cough, mucoid, yellowish, non-bloody sputum, and an on and off fever. On the day of admission, the Queen was diagnosed with urinary tract infection. She stayed at the hospital for 1 week. Although she was given medication, her illness still persists. 3 weeks prior to her second admission, at the hospital within this city, the Queen started to have rashes on the bridge of her nose and maculopapular rashes at the trunk and extremities. On the day of the admission of the said hospital, the client was diagnosed with community-acquired pneumonia, moderate risk, systemic lupus erythematosus, anemia secondary.
For the Queen's current health status, although she was ambulatory and well-groomed, she cannot hide the butterfly rush on the bridge of her nose, as well as the abdominal distension and the bipedal edema noted on her lower extremities.
The Queen was also resolute in finding a cure to her illness. Her honorable guard, Jedediah, was one of them. He was her confidant during such time, and the Queen had planned to seek the help of the council, a group of people who studied in the field of disease and the nursing process.